Welcome back to our channel AGJM, where we explore fascinating topics in psychology and mental health. Today we're diving into the captivating world of agoraphobia. Prepare to discover the intricate web of this disorder that affects millions of people around the world and learn how it can have a profound impact on their lives. To fully understand agoraphobia, let's begin by delving into its history. This psychiatric condition was first recognized in the late 19th century when it was described as a fear of open spaces. However, over time, researchers discovered that it was much more complex than initially believed. It wasn't until the 1970s that the diagnostic criteria for agoraphobia as we know it today were established. This breakthrough helped professionals distinguish it from other anxiety disorders, such as panic disorder. Agoraphobia is now defined as an intense fear or anxiety about being in situations where escape might be difficult or where help may not be readily available in the event of a panic attack or other distressing symptoms. Let's take a deeper look at a woman who was diagnosed with agoraphobia. She had a history of health problems, including cataracts, colon cancer, and hearing problems. She reported having a fear of going outside or being alone, so much so that she obligated her husband to stay at home with her at all times and confined herself to her bed at all times. She had no hobbies, not even watching TV. She even had to use a bedpan and have sponge baths. She feared falling, dying, or being left alone because she thinks that she would be victim of a crime and not be found in time. Other than these symptoms, she had healthy cognitive functioning capabilities, but her disorder prohibited her from flourishing. She was diagnosed and treated with increasing doses of sertraline, behavior therapy, and exposure therapy. Her condition improved over the years of her treatment, and she was able to move around her house comfortably and even leave on occasion. This woman's diagnosis and journey through her condition demonstrated how severe agoraphobia can be. While this condition is often portrayed as a fear of leaving the house or being in crowded places, this case study demonstrates that agoraphobia can be much more traumatic and debilitating. The woman's agoraphobia went as far as restricting her to her bed and affecting her family members' abilities to leave the house as well. Now let's uncover the telltale signs and symptoms of agoraphobia. The most noticeable feature is anxiety or fear when faced with specific situations. These may include being outside the home alone, being in crowded places, using public transportation, or even leaving the home altogether. Individuals with agoraphobia often experience intense panic attacks or debilitating anxiety in these circumstances. What factors contribute to the development of agoraphobia? While the exact causes are not fully understood, researchers believe that a combination of genetic, environmental, and psychological factors play a role. Traumatic experiences such as being involved in accidents or witnessing violence may trigger the onset of agoraphobia. Additionally, a history of panic disorder or other anxiety disorders can increase the likelihood of developing this condition. Fortunately, there are effective treatments available for agoraphobia. The most common approach is cognitive behavioral therapy, or CBT, which helps individuals gradually confront their fears and develop coping mechanisms. Exposure therapy, a specific type of cognitive behavioral therapy, allows patients to face their anxiety-inducing situations in a controlled and supportive environment. Medications such as SSRIs, which are selective serotonin reuptake inhibitors, may also be prescribed to alleviate symptoms. Remember, if you or someone you know is dealing with agoraphobia, seeking professional help from a mental health specialist is crucial. They can provide the guidance and support needed to overcome this challenging condition. As we conclude this exploration of agoraphobia, we hope you gained a deeper understanding of this complex psychiatric disorder. From its historical roots to the treatment options available today, agoraphobia reminds us of the strength and resilience individuals possess in their journey towards mental well-being.